Bringing a baby into the world is both magical and, let's be honest, a little overwhelming. There's a lot to learn and a lot to worry about. One thing you might hear about early on is the metabolic test or newborn screening. Today, I want to walk you through exactly what that is, why it's important, and what you can expect. Okay, so first off, what even is a metabolic test? Well, right after your baby is born, usually within the first 24 to 48 hours, a tiny sample of blood is collected from your little one. It's often called the heel prick test because, you guessed it, a nurse will gently prick your baby's heel. It's super quick, just a few drops of blood on a special card and you're done. I know, the idea of your newborn getting poked can tug at your heartstrings. But trust me, this test is there to help. The metabolic test checks for dozens of rare but serious conditions. Things like metabolic disorders, hormone problems, and certain genetic diseases that wouldn't be obvious just by looking at your baby. If caught early, many of these conditions can be treated, helping your child grow up healthy and strong. So, what's actually happening in the lab? That tiny blood sample gets sent off and tested for things like phenylketonuria, PKU, congenital hypothyroidism, sickle cell disease, and more. Every country and even some states might screen for slightly different conditions, but the goal is always the same: to catch these issues before they cause harm. You might be wondering, what happens if something pops up on the test? First, don't panic. Most babies get a perfectly normal result. But if there's an abnormal finding, you'll hear from your doctor, who will explain the next steps. Sometimes the first test just needs to be repeated. Other times, your doctor will guide you through follow-up tests or treatment options. The key thing is, early detection can make a huge difference. Now, a quick note. This test doesn't check for everything under the sun, but it's an amazing safety net for the stuff it does cover. And remember, it's totally normal to feel nervous or even a little teary when your baby gets their heel prick. I've been there. But in just a few seconds, you're giving your child a head start on a healthy life. So if you're in the hospital or at home with your newborn and someone mentions the metabolic test, you'll know exactly what's happening and why it matters. And as always, if you have questions, talk to your doctor or nurse. They're there to help. Thanks for letting me share this moment with you. Take a deep breath, give your baby a snuggle, and know you're doing an amazing job. See you next time.